Good afternoon, everybody. It's another sunny day. This is Wednesday, April 29. Today I'm here with Erin Neal, our VP of Ops, whom I believe you all know. And we're here to talk to you today about what we are calling our clinical recovery, a new stage for us. It's unclear when the shelter in place will be lifted, so it's very clear that we need to learn how to practice medicine in this new environment. So we're here to talk about some of the initiatives and workflows that have been designed to that end. But before we get to that, I do want to congratulate everybody for the remarkable job that everybody's done to bring us to where we are. If you think back just 2 months ago, we were a completely different group practicing different medicine. I think we took it for granted. No one could have imagined where we are now. I particularly want to highlight everybody's efforts to create a safe place for us to be and to practice medicine. You're all aware of the measures we've taken for that, and I hope you feel confident that you are safe. I cannot overemphasize this enough, because without us feeling confident, we will not be able to make our patients feel confident and safe. Without our patients feeling confidence in the safety of our clinics, there will be no clinical recovery. I have sent out yesterday a smart phrase that's called .SmuggerSafe that you might find useful. I created this when I communicate with patients on MHO to encourage them to seek care, and then let them know that it's okay to come in the office. So edit that or use that as you find useful. So I'd like to turn over to Erin to talk about some of the newer initiatives you might not be aware of.
Well, hello everyone, and I just want to reiterate some of the things that Gary has said here today. I find myself in front of you again, and I am kind of just in awe at your resilience and your flexibility during this time as you're taking care of the community, but also having the job of taking care of your family, your friends, and hopefully yourselves. And I hope that you are taking time to take care of yourselves. And we know that safety is of paramount importance right now, as it always is. We have it as our highest priority. And we've put together 5 teams that are actively working in the background on your behalf to bring patients back into the clinics, whether it's in person, virtually, through video, telephone, My Health Online, or back into the ASC in the hospital. The first team is our facility team, which is led by Rod Schillinger. That team is really a site visit team that will be coaching the safety of the facilities. They'll be looking at things such as signage, the screening in process, check-in, hand sanitizing, masking, the cleaning of exam rooms, how those are being handled, and making sure that every aspect of infection control is taken in place, how the waiting room is set up to make sure that it's social distancing. So there's a whole team that is looking at that clinic by clinic. The second team is the My Health Online team, which is being led by Jonathan Richards. This team will be reaching out to patients that are not signed up for My Health Online. This is our effort to make sure that we have virtual access for this patient panel. We know that within the foundation, we only have about 67% of our impaneled patients on My Health Online. So this is very important that we actually reach out to these patients and coach them on how to use My Health Online. We'll also be looking at easy arrival and some other programs. I think that this is really important for the specialties, as they have a lower My Health Online enrollment than primary care. The third team is a big, robust team, which is our recovery team. That is being led by Dan Early, and that is our way of bringing patients back into the clinics, whether it's virtually, inpatient, or through the ASC in the hospital. They will be looking at workflows and setting up processes specifically for this, and around referrals, cancellations, all of these avenues that we'll be using to try to help you bring patients back into the clinic. The third is a staffing team, which is how we're allocating staff. I am leading that group, so we are looking daily at what our needs are with staff and how we can best allocate staff and retrain them to do jobs that they might not have done before. And the fifth team is the training and sustainment of standard work team. This is very important, as our standard work is changing day by day, sometimes hour by hour, and how are we coaching and actually standing up that standard work so that our staff are trained appropriately for the patient care that we're facing. And of course, Dr. Mitnick is the one that will be leading up that team. A lot of work going on in the background, so thank you for letting me be here to tell you what we're doing.
It does make me appreciate the challenge of operations, trying to flex our staff while we practice medicine, yet we tackle some of these really important initiatives. So I think what I want to say next is that really it's time to invite patients back to care here. And I use the word invite specifically because if you look at the volume of patients in the emergency room, in the hospital, in our same-day care, volume's really down. And so that tells us something. I think that tells us that our patients are reluctant to seek out care in the current environment. But because we feel safe and we feel strongly that we've created a safe environment, as we contact patients, we should feel free offering them the ability to come in for an in-person visit or take a video visit, whatever sits with their level of comfort. It was back on March 16th when we chose to de-escalate and we canceled and deferred a lot of care. Well, a lot of time has surpassed now and those patients need our care. So it is indeed time to invite them back into the clinics. I've thought about a few areas that we do have touch points where you can leverage the opportunity to bring patients into care. Erin mentioned a few of those. There are backlogs of referrals, there are backlogs of cancellations. I know some of our primary care physicians have a backlog of new patients who have not been able to come in. One of the ways that I use to reach out to my patients is the touch points that I have every single day in my in-basket. So these would be refills, lab results, or MHO messaging. That gives me the opportunity to review their chart, and if I see it's clinically important for them to come in, it's been a year, or they just have active problems that need to touch bases, I write to them and seek, and I send that to my staff saying, reach out to the patient, set up an appointment. And I do want to make one point here, just let's not forget our behavioral health patients who sometimes need some human contact and keep them in mind. So in addition to that, we do have each department setting up a list of diagnoses or symptoms that would be appropriate for video visits, such that our PSRs can go ahead and schedule those without having to consult us. But you know, in reality, the decision to have a patient come in or even a video visit, the decision to practice care is a clinical decision. You do not need us to remind you when somebody comes in. You do that every day. You know how to do that. So in conclusion, I just want to say we live in a pandemic right now. None of us, I dare say, have lived through a pandemic before, so there are no experts about how to do this. So I would recognize that those on the front line, those who are seeing patients, who are rooming patients, who are scheduling patients, you may very well be the authorities on how best we can do this. So I'd encourage you to get engaged. And as you see, come up with ideas or see ways that we can change our safety habits or that we can smooth out our workflows, please feel free to escalate those ideas to your manager, because we're all on the same team here. We need your help. So I hope you found this useful. Erin, thank you, and thank you for your time.